Basically, the rule is the baby gets what it needs.
Oh, yeah.
And if you don't have any extra, they get yours too. And they get it literally from your brain.
Yep.
They will actually rob your brain of nutrients.
Welcome back. Today, Dr. Tracy and I are going to talk about prenatal care from a naturopathic perspective. Mm-hmm. So when you have a patient in front of you and she's very excited because she's 6 weeks pregnant, mm-hmm. what do you ask her, and then what do you recommend?
Well, we go through the things you would do with anybody. What are their concerns? Mm-hmm. How are you feeling? Certainly.
Yeah, and usually they say, I'm feeling tired.
I'm feeling tired.
And possibly nauseous.
Possibly throwing up. And sometimes there's anxiety, and sometimes there's a lot of questions about what they can and can't take.
Right.
Key questions always.
Like in terms of vitamins and supplements.
Vitamins and supplements.
And foods too.
Yeah, that's true. There's a lot of questions. So a lot of what we do is answer those kinds of questions. Mm-hmm. The rule of thumb with supplements and herbs is you do, especially in the first trimester, you do the minimum. You only do things that are absolutely essential, simply because we can't do research on pregnant women. It's unethical. It isn't done. Ever.
Yeah.
The only information we have is, well, it seems that many, many millions of people have consumed this food when pregnant and nothing weird seems to have happened, so it must be okay.
Right.
That's the kind of information we have. And so for specific interventions such as medications or herbs, that's the only information we have. Mm-hmm. And so we minimize use of supplements and herbs in early pregnancy unless it's indicated. And there's some that we do use. For example, carefully.
Ginger, right? We might use ginger for nausea, and that's a herb, but it's also a food. Mm-hmm. Yeah,
exactly. Or there's one of our favorite Chinese herbal formulas, Tang Kui and Peony, which is actually a formula designed to support pregnant women. That's what it's for.
And it's about 800 years old or so.
Yeah, so we figure we're okay.
Yeah. It's been used for hundreds of years for women in China. Mm-hmm. The thing too, just to add to what you're saying about how, we're cautious in first trimester, it's not just us too, like our medical doctor colleagues who prescribe medications. It's the same thing, right? You can't research what a drug does in pregnancy. You can't research what a herb does in pregnancy. No. So all practitioners who prescribe any kind of substances are very cautious.
Very careful.
Yeah.
Very careful across the board. Absolutely.
Yeah.
And part of the problem with that is that people think they can't take anything, and so can sometimes quit their supplements or quit their medication support and then feel really lost. One of the safest interventions we have in pregnancy is actually acupuncture. We do a lot of acupuncture in pregnancy. There are a few points that you can't use, and all the rest of them are fine. Yeah. And we know which ones we can't use. It's fine. We're very clear on that.
Acupuncture, don't do it yourself at home.
Right. Other than that, it'll be okay.
As long as you're with a licensed practitioner, they know which points to not do when you're pregnant.
Exactly. And so we can do acupuncture support for things like constipation, or sleep, or anxiety, or heartburn. Oh my goodness, yes, heartburn in pregnancy. Yes.
Very common near the end. Most pregnancies, really.
Yeah, absolutely. And my favorite is, of course, acupuncture for morning sickness. Mm-hmm.
Yeah, it works really, really well. And not only can we do acupuncture when the patient is in front of us, but we can actually put these little things called ear seeds, which are they're tiny seeds on the back of a Band-Aid. They're called ear seeds because there's lots of points in and around the ear that are very active and on the surface. But we can place those on any point to direct the patient in how to do acupressure at home.
Yes.
So there's a very useful point right here. Mm-hmm. And if you buy those motion sickness bands at the drugstore, Shoppers Drug Mart, I think, carries them, that's the point that those bands stimulate.
Yes.
Yeah.
Yep. And so acupressure can be used. Acupuncture more effective, and acupuncture I would say, usually 3 or 4 treatments to completely resolve. More if it's a really stubborn case. where a person is very ill or it's going into the second trimester. We also do use acupuncture in pregnancy to get ready for labor.
Yes. And not just induction. Like we don't wait until it's time to induce.
Although we do that as well.
We do that. We love using acupuncture for induction. So many of the midwives in town will refer to us when, someone's at week 40 or maybe they're at week 39 and there's a bunch of medical reasons why it's a better idea to give birth sooner rather than later. The midwives will send the patient to us and we will do induction acupuncture, and it can help things get started. But for our very proactive patients who are already familiar with us and have been getting prenatal care, they will start with pre-labor acupuncture on a weekly basis at week 36 of their pregnancy.
Yeah, there's a ton of research on using, we will generally do 4 treatments, week 36, 37, 38, and 39, and specific points. And we do them because the research shows a 20% reduction in the amount of time that stage 1 of labor lasts.
Yeah, which is great.
Yeah, absolutely. Shortening that up is super helpful. People appreciate the break, and there are better outcomes, and the research does support this. And so,
fewer interventions. Medically speaking. The woman has an easier time of labor, and it's really neat what these points do. There's a point on the inner calf here that helps to ripen the cervix. And that's, people might think, well, the point isn't anywhere near the cervix, but this is the power of the meridians in Chinese medicine.
There's another point to optimize the position of the baby.
Yes.
Right? And it can be used, we do something called moxa on it. Moxa is a certain herb that's burned on or near an acupuncture point, and we moxa this point if we have a breech baby. Now that is optimally done before 35 weeks.
The earlier the better.
The earlier the better.
Because you want more room for that baby to shift inside the uterus. And so if it's really late stage pregnancy, there's not a lot of room to move anymore. Yeah,
it gets very difficult to do. And so we can moxa that point if it's breech, but if it's not breech, if the baby is head down, then you can do acupressure or acupuncture on that point to optimize the position and try to avoid back labor.
Yeah.
Right? And anyone who's experienced back labor doesn't want to do it a second time.
Yeah.
Right. And that back labor is simply when the baby's not rotated at the optimal angle. To get out.
To be fair, you can still push a baby out that way, but it's just more work. Easier. It's more work. It's more discomfort. And so, there's an optimal way for baby to come out. Now, I have to tell you, one time I had a patient with breech baby. She was, probably 35 weeks. And her mother came to the appointment. This was before COVID, when we could stick 3 people in a small room.
Yes.
So I was teaching her mother how to apply the moxa sticks to this point, urinary bladder 67. And she was lying there on the table, and you could actually see her uterus changing shape as the baby started to shift during the moxa treatment. It was very cool.
I find in the pre-labor acupuncture in the last month of pregnancy, often the baby starts doing a bit of a jig. When you're doing acupuncture, they're like, "Whoa!"
Yeah,
they can really feel it.
Yeah, it's pretty incredible. When I'm doing induction acupuncture, I make sure that the woman's in a comfortable position and that they're prepared for Braxton Hicks contractions to kick in.
That's true, yes. And the normal pre-labor acupuncture, we're not doing those points. It's only right when a person's ready to have a baby. Ready to have a baby.
Or as some of my patients say, I'm ready to give this baby the eviction notice.
Yes, absolutely. Most people get to that point. So, And what else do we do in terms of pregnancy support?
Prenatal vitamins. I will say there's a lot of low quality prenatal vitamins out there.
Yes.
I mean, when it comes to Health Canada, anything can be called a prenatal if it has 1 milligram of folic acid in it. But a lot of the mainstream low-cost brands, you'll look at it and you'll be like, oh, this is great. There's calcium, there's magnesium, there's B12. But if you talk to someone about dose, like a naturopathic doctor, pharmacist, someone who, knows about the dosing, they'll tell you, well, this is ridiculous. It's like a tiny micro dose of B12. It's not going to do anything.
Yes.
So if you're going to invest in a prenatal, it's great to invest in a high quality prenatal, which obviously we have them here for our patients. And I prefer that my patients get active folate instead of folic acid.
Yes.
Because it's just better absorbed in the body. And some women don't react well to synthetic folic acid.
Yeah, so when we talk folate or folic acid is the one that everyone worries about. If you are due to one thing, that's the key one to do. And sometimes when I have somebody who is experiencing a lot of difficulty taking supplements in the first trimester, they're not keeping them down.
Yeah.
We will do just folate.
Yeah, just active folate.
Just active folate, nothing else, because that's the critical one. And so on a label, you'll see folate. Any label for a vitamin or a mineral will have the vitamin or mineral listed, like vitamin A. And then in brackets beside it, it will tell you what form it's in. So vitamin A, for example, can be either vitamin A palmitate or beta carotene. And so when you're looking at the folic acid, what you're looking for is in the bracket is either folate or 5-MTHF, which stands for 5-methotetrahydrofolate, which nobody can say or spell. So 5-MTHF or folate rather than folic acid. Folic acid is a synthetic and folate is more bioavailable. And in some genetic variants, it works better.
Yeah.
And so since we don't all have our genetic testing done, we might as well all take the best kind.
I agree.
So that we get the best results.
Absolutely.
You want to speak about probiotics in the third trimester?
Yeah, so probiotics are especially important for any women who have an atopic family history. So what that means is does eczema, allergies, and asthma run in your family, right? And maybe you don't even have those conditions yourself, but all your relatives do. There's good evidence to support taking a probiotic in pregnancy, and that will reduce the chance that your baby will have any of those three conditions.
Yes.
And we've got ideas about specific strains of probiotics that can help more or less, but just taking any probiotics better than nothing at all.
Absolutely. Yeah.
Oh, back to nausea and vomiting for a second. How often do you prescribe high dose vitamin B6? I prescribe that and ginger. Yeah.
When I also recommend acupuncture, but the acupuncture can take a few sessions to kind of kick in, and in the meantime, it's useful. So the medication that people are familiar with for taking for nausea and vomiting of pregnancy is diclectin.
Yes.
And diclectin is an antihistamine plus high doses of vitamin B6. The research is leaning towards an explanation that it's just the B6 that's doing the job, though.
Interesting.
And the antihistamine just makes you sluggish. But we don't really know. The jury is a bit out on that one. For the last time I looked into the research, but the B6 alone does have good research on it and is sometimes better tolerated. Diclectin is also safe and can be prescribed by a medical doctor or a midwife if a person is suffering.
Absolutely.
And I don't discourage people from doing it if it's working for them. But if they're not on anything...
anti-drug. That's probably a myth we should dispel, because some people do assume that because we're naturopathic doctors that we're anti-drug, but not at all. Pharmaceutical interventions can be life-saving. They can save someone's quality of life as well.
Yes.
So we are practitioners who believe in anything that works.
Yeah.
We have a big toolbox here, naturopathically speaking, but when you need a pharmaceutical intervention, that's okay.
Yeah. Well, and I think to use the jargon, we believe in evidence-based medicine.
Absolutely.
And if the evidence...
I'd say even more so now, evidence-informed medicine.
Yes.
Yeah, because now the definition's changing to include other types of evidence, not just the randomized control trials.
Yes. So and in non-jargon, that simply means if the evidence tells us that something works, we support it.
Yeah.
We don't let our theories or our philosophies dictate what what we recommend. I'm not going to recommend something because I want it to work, right? I'm not going to or discourage something because I don't want it to work. I'm going to recommend what works, or advise somebody to, speak to their medical provider if I think that that's really the best route to take.
Absolutely. I mean, we refer to other healthcare practitioners all the time, and we do sometimes refer people back to their medical doctors or nurse practitioners. Another thing that I often prescribe in pregnancy is a high quality fish oil.
Absolutely.
Because a lot of women talk about baby brain when they're pregnant or when they're breastfeeding. Yes. And so I'm like, okay, so a high quality fish oil will have a good dose of EPA, omega-3 fatty acid. That prevents baby brain in the mom. And then the DHA is what the developing fetus and then developing baby needs for nervous system development and brain development.
Yeah, so these are our essential fatty acids, our omega-3 essential fatty acids, and the development of baby brain in pregnancy and when breastfeeding. Basically, the rule is the baby gets what it needs.
Oh, yeah.
And if you don't have any extra, they get yours too. And they get it literally from your brain.
Yep.
They will actually rob your brain of nutrients.
Or your bones.
Or your bones of nutrients.
I know a woman who had a tooth that just crumbled during pregnancy because it was more important for that baby to have a femur and develop leg bones than it was for her to have the tooth. And that's how nature works, right?
It is, yep.
Baby will take what baby needs. So it's funny because a lot of women come in and they're like, I want to make sure that this baby's going to be healthy. And I'll say,
baby's going to be fine.
Baby's going to be fine, but we got to take care of you, right? And obviously we're taking care of mom and baby.
Yeah. And I think it's possible to get enough of your omega-3s from diet, but let's be honest, most people don't.
No, most people are not eating fish, 3-4 times a week.
No. The only people I know who eat fish that regularly live on the East Coast or the West Coast.
Yeah.
They don't live in Northwestern Ontario. Yeah. Except the most ardent of fisher people, fisher folk.
Exactly.
The rest of us, not so much.
So before we wrap up, I want to know if you have anything else you want to mention, but I also want to mention red raspberry leaf tea in third trimester.
Right.
As something that's a great uterine tonic and can just get your uterus ready for the big day.
Yeah. I would actually start raspberry leaf tea earlier.
Yeah.
And generally combine it with nettle tea because they both are very good sources of iron as well.
Yes.
And iron deficiency is incredibly common during pregnancy. And some people don't tolerate iron supplements terribly well. Now, we do have iron supplements here that are better tolerated than most.
Absolutely.
And definitely, if you're like, no, I don't want to take iron, it does terrible things to my gut.
Yeah.
You need to talk to us or our staff.
Come here
and get the better stuff and get the stuff that it doesn't disturb the digestive system as much. But if you can get it from food, and certainly nettle tea is wonderful for the iron, and raspberry leaf tea is, I started in second trimester.
Absolutely.
Because of the nutrients in it. It also provides calcium as well. And raspberry and nettle provide both uterine support. It doesn't stimulate the uterus, it makes the uterus stronger. Yeah. Which is what we want. And it provides nutrients for the body as a whole.
Absolutely.
So, and other than that, there isn't any broad things that I always do in pregnancy. It's
really case by case.
Case by case, yeah, absolutely. If I have somebody, as I said, we minimize the herbs and supplements in pregnancy, but sometimes somebody needs support for another health condition and they happen to be pregnant at the same time. And we very mindfully and very carefully address those other concerns as well.
Absolutely.